Hi guys, Rachael Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, I'm going to be telling you how to clean your Phonak hearing aids. Coming up. If worn as directed, hearing aids are on or in your ears for somewhere in the realm of 10 to 16 hours a day, and they're exposed to all kinds of dangers. These include moisture like water and sweat, debris like dust and dirt, and of course, earwax. One of the best ways to ensure that your hearing aids will continue to provide the appropriate amount of amplification over the average 5 or so years of use is by being consistent with your cleaning and maintenance routine. I can't tell you how often I see patients in the clinic for hearing aid consultations with relatively new or premium level devices that just aren't working as well as they used to. This might lead you to believe that you already need new hearing aids. But what if I told you that the solution might just be a better cleaning routine? That's why today I'll be reviewing the maintenance methods and schedule to keep your Phonak hearing aids working in tip-top shape. And if you've got devices of another brand, don't go anywhere just yet, because most of the information reviewed today will be applicable to hearing aids of all types. Just be sure to drop the hearing aid make and model that you wear in the comment section below so that I know which video to film next. And while you're at it, please be sure to hit that like button as well as that subscribe button with notification bell so that you never miss any one of our newly posted videos. We really appreciate the support, and with that, let's jump right in and review how to clean your Phonak hearing aids. The first and most frequent item that you will need to clean on your Phonak hearing aids is the acoustic coupling on the end, whether it be a custom ear mold or a non-custom dome. Because this is the piece that's actually going into your ear canal, it's definitely exposed to higher levels of humidity and, of course, earwax. You'll want to begin by wiping down your ear mold or dome with a tissue or an alcohol wipe every time you see buildup, and at a minimum about once a week. If you have a custom ear mold, you'll also want to use a vent brush or cleaning stave to remove the wax that might build up in your vents. The vent controls how much sound is actually contained in your ear canal, and a plugged up vent won't necessarily impact hearing aid functionality, but it will change the sound quality temporarily until it's clean again. Interestingly enough, I actually love bridge floss or nano cleaners for this job, as it's rigid enough to slide through the vent, but widens up to clean the vent nicely as you pull it through. However, most patients can easily get 3 or more months of use out of their domes, so don't feel the need to replace these too often. Also, beware of purchasing replacements on the internet. Not only do these come in a variety of sizes and properties that can be easy to confuse, but also many sites actually sell counterfeit products. They often do not fit the product correctly and can even fall off inside of your ear canal and need to be removed by your provider in office. So I definitely recommend just getting your replacements straight from your provider. If your ear molds or domes are constantly covered in wax, you definitely want to talk about management strategies with your provider. This might mean scheduling more regular earwax removal visits, or by using some sort of earwax softening drops and flushing solution at home in between visits. And this is pretty important when it comes to the next step in cleaning your hearing aids, which is changing out your wax guards. Wax guards, otherwise known as wax traps or wax filters, are designed to prevent earwax from getting into the receiver, which is really just the speaker that sits in your ear. When wax fills up the opening of the receiver, sound is not strong enough to push through this barrier entirely, which can make your hearing aids seem weak or even completely dead. This is perhaps the #1 reason why you might believe that your hearing aids are broken, but it just so happens that it's also an incredibly easy fix. Now, the type of wax guard you will use is dependent on the receiver type and acoustic coupling. Almost all Phonak custom ear molds use the Stop wax guards, which are individual sticks. One end is used to remove the old or clogged wax guard, while the other end has a replacement. It's very important to remove and replace these wax guards by pushing straight in and pulling straight out, avoiding any angling that could prevent successful replacement. If you use rubber domes, your hearing aids may use this wax guard type, or it may use the Shield wax guards that are found in a replacement disc. Instead of using individual sticks, the Shield disc consists of a space to trash the old filter and a space that houses a replacement filter. After removing the old wax guard and replacing it with a new one, you'll use both thumbs to spin the wheel, revealing a new set of spaces to remove and replace your wax guards. Now, I will say that this style of wax guard has been incredibly difficult for my patients to use. It's super easy for these wax guards to get slightly off center, and once they are, they become nearly impossible to remove from the speaker unit. Not only that, but it can be pretty tricky to spin the face of that disc, and you have no idea how many you have left until you look through all of those empty slots. Luckily, earlier this year, Phonak announced that they were releasing new receivers for the Marvel, Paradise, and Lumity line of devices that are compatible with the previous Stop sticks, which are much easier to handle. Just be warned that if you're currently using one style of wax guard, that you cannot just change it out for a different style of wax guard until you're able to see your provider and have them switch out the receivers, because wax guards are not universally compatible. Now, your own personal wax guard replacement schedule will depend on your ears, but they should be replaced every time that you notice a decrease or a complete muting of the sound coming from your devices. For most of my patients, I still recommend just going ahead and replacing these monthly so that they don't plug up on you at the worst possible times, because we all know that's how it's gonna go, right? For this reason, I also recommend changing out those wax guards proactively before big events like weddings, graduations, or work events. And be sure to keep a backup pack in your purse or wallet, in the center console of your car, and in your travel bag to ensure that you avoid any potential mishaps from not having the parts and pieces that you need on the go. While you're working on the dome and the wax guard, you may notice some buildup around the speaker unit and the retention tail if you have one. This can just be wiped off using an alcohol wipe, but try to hold the retention tail in place if you can, since this can be tricky to put back on correctly if you haven't done it before. Now, the next part of your cleaning routine should be brushing off your microphone ports, which is where the sound is actually coming in to your hearing aids. There are 3 microphone ports located at the top of the body of the hearing aid on both the right and left sides, as well as a central microphone port directly below the lower push button. Now, microphone ports get exposed to all kinds of hazards, like water and sweat, dirt and dust, oil from your skin in your hair, and even hair products like hairspray. Without regular cleaning, they can fill up with debris, ultimately compromising the amount of sound that's able to make it into the hearing aid and, of course, back out of the hearing aid. For this reason, be sure to brush your hearing aid microphones once a week using a small cleaning brush or even a soft bristle toothbrush from the store. Use some gentle pressure and brush from several different directions to loosen up any buildup that could be blocking the internal microphones. You can use this same tool to brush around the push buttons on your hearing aids, as this is another area where debris can settle, making them hard to press. Another point of maintenance on your Phonak hearing aids will depend on whether they're rechargeable or use disposable batteries. If you have rechargeable battery hearing aids, you will want to make certain that you wipe off the metal charging contacts on the back of the hearing aids with an alcohol wipe about once a week to ensure that any hair or skin oil doesn't coat these contacts and cause inconsistent charging issues. You may also want to take a peek inside your hearing aid charger to ensure there is no visible debris on the charging contacts housed within the charging ports for the right and left ear. These contacts can be wiped off weekly using a cotton swab, and if you return to your hearing care provider for regular maintenance, be sure to take your charger with you. In our office, we have tiny microsuction devices that we use to remove any debris from down in your charger that could cause charging issues. If you have disposable battery hearing aids, you will want to direct weekly attention to the battery door area to ensure there is no visible buildup here that could work its way deeper into the hearing aid. If you find any, this debris can be gently removed using a brush or a cotton swab. Now, I will say, no matter how consistent you are with at-home maintenance, you will still need to prioritize regular in-person visits with your provider. Hearing aids, like cars, certainly benefit from at-home cleaning and maintenance, but will definitely require professional maintenance over their lifespan. Some maintenance visits are relatively surface level, consisting of your provider taking a look into your ears and removing any earwax as necessary, deep cleaning your hearing aids, and issuing you any replacement supplies. Other visits may be a bit more intensive, consisting of updated hearing evaluations, diagnostic testing of your hearing aids, and running real ear verification measures to ensure that your hearing aids are still meeting your hearing loss prescription. These check-in visits are really important because they're the only way as a provider that we can catch small problems before they turn into big problems. But ultimately, your return visit schedule should be decided upon by yourself and your provider. This is going to be based on your hearing aid performance as well as your own independence in completing the care and maintenance of your devices. To review, be sure to wipe off your ear mold or rubber dome with a tissue or alcohol wipe when any debris is visible, but at least once a week. Replace your rubber dome as needed, particularly if it is ripped or torn. Replace your wax guards at the first sign of weak or muted sound coming from your hearing aids. If you go a full month without needing to replace them or have an important event on the books, switch them out proactively to avoid clogging up at the worst times. Brush your hearing aid microphones weekly to avoid buildup. If you have rechargeable hearing aids, wipe down the battery contacts on your hearing aids and in your charging ports weekly to avoid intermittent charging. If you have disposable battery hearing aids, brush or wipe out your battery door once a week. Now, some of these skills might not come easily right away, and for that reason, it's incredibly important that you spend some time practicing these skills with your provider to make sure that you're doing them right. But overall, hearing aid cleaning and maintenance is an often overlooked component of hearing aid use that can make all the difference in the world when it comes to hearing your best.